Hi, my name is Jason Clark, and I'm about to do my informative speech. When it comes to end-of-life care, most of us don't realize that can also include ending life early. Many patients choose to quicken their death through numerous different options. Depending on the state, those options can be illegal. Today I'm going to discuss assisted suicide, voluntary passive euthanasia, and how we can keep people from misusing them. There are many different ways a dying patient can end his or her own life. The most widely known is suicide or assistance in death. The doctor gives the patient a fatal amount of medication, where the patient is the one who injects and swallows the medication. In assistance in death, it is the patient who causes his or her own life to end. This form is only legal in the United States, Oregon, Washington, and Montana. The next most common form is voluntary passive euthanasia, and is where the patient declines care or life-sustaining medical treatment, such as life support or feeding tubes. This option can take weeks and is highly painful at times. Voluntary passive euthanasia is illegal in the United States due to the court's ruling that it is a patient's right to refuse care and to end their own life. The least common form are involuntary active euthanasia and involuntary passive euthanasia. These forms are when the patient has not said they want to end life health, but a doctor or a family member removes care or causes the death through medication. The last two forms are seen as crimes in most parts of the world. In every country or state that allows assistance in death, there are guidelines that must be followed by the doctor. 1. The patient must have a disease that is going to result in the end of their life. 2. The patient must be aware of options to prolong their life. And 3. The patient must be making this request with a sound mind and on their own. Washington State requires the patient to ask the doctor in writing and in person twice within a week apart. After the act has been done, the doctor is to notify authorities, and if any steps are not followed, the doctor can be charged with murder. These guidelines are put in place to ensure that it is the patient is not being used, and that it is his or her own wish to die. It should be noted that these people that ask for assistance in death or voluntary passive euthanasia are not the same as people who kill themselves from depression. They are not choosing between living and dying. They are choosing between dying painlessly and dying with pain. People need to be informed of these options, and there needs to be a public debate in this country on how and when to allow people to end their own life. Thank you.